Our, our agenda is primarily focused on early childhood development. We have a couple of great presentations today. In terms of updates, I think there's at the top of the agenda a legislative update, but I think we're really going to cover most of that in our presentation today. We're really excited that our Department of Education colleagues can talk about the changes to CDS. I will also, in a moment, turn it over to Tara to talk about what happened in childcare and where we are on childcare, another really exciting set of policies on the horizon. And with that, I do want to take a moment of personal privilege to talk about the fact that I'm trying to avoid the word last, but this is actually my last Children's Cabinet meeting. I am leaving my job a week from Friday, but I know I'm leaving this cabinet in great hands. When you look at the work that's been done in the first year of reconstitution of the cabinet, it created very clear goals, a real specific set of strategies and programs. I am proud to say that there's been a ton of progress on those goals, from the $8 million preschool development grant to early childhood consultation for mental health, the first 10 schools, first for me on the early childhood development part. And I'm glad to see Commissioner Fortman because so excited about the work that's been done on pre-apprenticeship, apprenticeship, career development, really giving our youth in Maine a real leg up as they enter adulthood. The commissioners on this cabinet are just fabulous. Thank you, Commissioner Fortman. I don't know if Commissioner Sawstruck has joined us yet. Please, Christine, thank Commissioner Liberty. And clearly our close partnership, Megan, with Commissioner Macon has been invaluable. I do see many of the staff on the cabinet here, and I think, again, really amazing, good work groups. I actually don't recall working with cross-agency teams that have done as much as effectively as Children's Cabinet staff groups. So thank you all, but special thanks to Anna Hicks. I don't know what we did before she got here, and I know going back to looking forward that much of the new ideas in the horizon that we'll talk about today in the future meetings are the result of her strong, quiet, and effective leadership. So Anna, thank you very much for doing all of our work here. So I do think next off though is Tara to talk about what's going on in childcare before we turn it over to Megan. Thanks.
Okay, thank you so much. Can everyone see the slides? Okay, wonderful. Well, I'm excited to talk to you all today about some updates happening over here in our Early Care and Education Division at OCFS, specifically around some childcare initiatives. The first thing is that every 3 years we do a market rate survey where we send a survey out to all licensed childcare programs in the state asking them what their private pay rates are. We look at it by geography, by program type and size, by age group, what they're charging for infants versus toddlers versus preschoolers. And then we use that to set the reimbursement rates in the child care affordability program, child care subsidies. And this year, the process and the analysis was a little bit different because OCFS, along with GoPIF and DOE, have been doing work on cost modeling, cost analysis around the expenses that are incurred and what the cost of care and learning is in our childcare programs and our public pre-K. So just to quickly give an overview of this, one of the things we think about when we're looking at the childcare market is that we can use some information to understand whether the market is functioning well or not. So if providers are able to charge families enough to cover their costs, that's one indicator that the market is working well. And an implication for that for us at the state level is, are we setting our subsidy rates to ensure that the most families possible can access the childcare market? We can see an indicator that the market is not working well if providers are not able to charge parents a high enough fee to cover their costs. And that we want to set our subsidy rates. If it matches the market rate, but that rate that providers are charging is not covering the cost, then that's not necessarily supporting the viability of the market. When we look at this information, we, as I mentioned in our market rate survey, look at what providers are charging. We use that because we really want to understand the fees that parents are paying and the rates that parents have to pay to access childcare and how that differs across geography and across program type. When we're looking at costs, we've been doing an analysis with the Center for Early Learning Funding Equity that helps us understand cost in a couple of different ways. So in the first red column here, looking at the costs that are required to kind of meet the foundational costs of a childcare program. How do you get licensed and meet your health and safety standards? And how do our subsidy rates cover that cost? And we've also been looking at what is called here in quotes, the true cost of care. So what does it cost when providers are trying to meet quality standards that will incur more materials, supplies, credentialing, training, degrees for their staff, and what kind of adequate compensation for the teachers and staff in the program is needed to maintain that quality and that stability of quality. And then what funding and what rates would we need to get there? Our rates this year do not get us all the way there, but they make a good leap forward in going on that trajectory. So what we found and what this graphic is showing is that the difference in the cost of care across the state, if you look at the child care centers where there's that little line from 0 to 5, is that there's only a 5% difference in the current costs that programs incur, their expenses overall to run a child care center from north to south and east to west across Maine. There's about a 10% difference in what family child care programs incur in terms of their costs. But our current subsidy reimbursement rates have a 45% difference geographically across the state and by program in what we're reimbursing. And so that means that some programs are receiving as much as 45% lower in reimbursement rates than others. And what we noted with the Center for Early Learning Funding Equity is that the northern and rural counties are the ones getting significantly lower because parents in many of those counties can't pay as much for care as what parents can pay in some of our more southern and coastal counties. And so our market rates in our state and all others have really been kind of following that path for a long time. So what we did this year is we created 2 rate regions. In the past, we have reimbursed in where rates are different in up to say 10 regions across the state. This year, Cumberland, Sagadahoc, and York counties are being reimbursed through one set of rates, and the rest of the state, all other 13 counties, are getting reimbursed through another set of rates. So this is creating less disparity. By bringing more counties together, it's averaging what they're charging parents to create kind of a closer rate and less, we don't have a 45% difference anymore. That's the bottom line. So that new market rate coming out in 2 rate regions and in a way that's going to better align with the cost of care is happening in July, and it is happening at the same time as other initiatives. We have a lot happening in July, just so kind of everyone's keeping in mind our date and what will be happening in childcare this summer. At the same time that market rates go up, which means reimbursement rates for programs go up, we also are expanding the child care affordability program to serve families up to 125% of state median income. So what this chart shows you is family size from 1 to 10 people in a household. The first column is the current cap on the program, which is at 85% of state median income. So for a family of 4, if the household income is $89,000 or below, they're eligible to apply for the child care affordability program. Starting in July, families can apply in that last column. That is the new income limit. So for a family of 4, the household income could be up to $130,000, and you can apply for a child care subsidy. One of the reasons I want to note how important this is to think about the benefits of serving more families is we in the child care affordability program often serve families with more than one child under the age of 6, or children who are accessing birth to 5 childcare and preschool in the private market, as well as after school age childcare. And so families who find themselves in a income category that's over 100,000, they may have been able to handle that cost with one child, but by the time it's 2 or 3, we now are giving them access to apply for this program to support the high costs that they incur for a period of time in raising their family. We also, at the same time, are implementing a pilot program as part of the child care affordability subsidy program. And this is a 2-year pilot where we are offering the ability for those who work in childcare to get what we might call automatic or categorical eligibility, meaning if you work in childcare, you are eligible for your family to have subsidy for childcare. So regardless of income and other factors that you may have been denied in the past if you had applied. This is a strategy that we are trying out that many other states are experimenting with at the same time. And Kentucky was the first to roll out to look at how it may impact the recruitment and retention of staff in childcare. This is a benefit that often that childcare programs try to implement themselves, where a director, administrator of a childcare will say that they will offer reduced tuition or free tuition for staff who work there, for teachers who work there, but it is they are limited in their ability to do that due to their really tight budgets. This is a quick overview of how that's going to work. We are going to make sure that people utilizing this scholarship are integrated in the system that we already have. So they will apply for the child care affordability program just like any other family does. What we're expecting based on the average income of most teachers in childcare is that they will likely already qualify for the child care affordability program. If they do, they will get the subsidy award through the child care affordability program just like any other family does, but we will scholarship their parent fee. So it will become this kind of full award or full scholarship. So we're basically weaving together the current program with the ability to scholarship whatever it doesn't cover. Here's another example. Right now, the way our federal and state rules work, we don't just look at income in the child care affordability program, we look at what's called need of care. So if one parent works full-time during the day and the other parent works at night, our current rules don't determine that as a need of care because during the day there is one parent available. This program would allow us to not have to consider that, which is a restraint that is very difficult for some families. You can imagine one parent, working at night, they are sleeping during the day. So it doesn't mean that family they probably do need some care. This pilot is allowing us to offer some of those things that we can't offer through the regular program, like you automatically get it, even if the federal rules normally would say you don't have a need of care. So there's just lots of ways that we can utilize this pilot to collect some data and evaluate the policies that we are allowed to use within a pilot program and learn from that. So I'm excited for us to have data to share later on. Just lastly, a quick couple highlights here. We'll also have stability grants going out that passed through this year's budget. It's a little bit over $5 million total. So we'll be granting programs $25 per license slot per month for 4 months. Just to give you a sense of how much money that is for a program, if you're a small family childcare that has maybe 6 children enrolled, you would be getting a total of $600 over the course of those 4 months. If you're a larger childcare center that has closer to over 100 children enrolled, maybe 150, you would get $15,000 total over those 4 months. And so programs are going to be able to use this to support some of their needs to be stable right now and to help parents access childcare. So helping to cover some parent fees or lower parent tuition and helping with their recruitment and retaining the workforce. And the last thing I have on here is just a quick snapshot, many of you have seen over the last couple of years that we've been rolling out these childcare infrastructure grants. And we are excited to report that we're now up to 195 awards, meaning 195 family childcare and childcare centers have either been awarded funds to expand their program or open a new program, with the anticipated slots created well over 4,500. And so far, the funds awarded are over $11 million. And so I have these slides that I'll make sure Anna can share. So you'll have that data. And here's a quick overview of the kind of categories. So how many of these awards have gone to new family childcare, family startup, family childcare growth is an expansion of a family childcare, and then childcare facilities expanding or starting up. And that's it.
Thanks, Tara. Any questions for Tara? Great. Well, and you recently joined the team at the Office of Child and Family Services and have hit the ground running with lots of initiatives to oversee. So thank you, Tara, for your leadership on all of that. It's exciting to see this work coming together. Great. If there are no questions for Tara, I'm going to turn it over to Megan Welter, who's going to walk us through an overview of some of the significant changes that are happening at the Department of Education around child developmental services and special education services for preschool children. Megan, take it away.
Thanks, Anna. And I'm here today with my two colleagues, Erin Fraser and Sandy Flack. I'll let them introduce themselves in a moment, but I'm Megan Welter. I'm the Associate Commissioner for Public Education, and I'll hand it to my colleague, Erin Fraser, to introduce herself.
Hello, everyone. I'm Erin Fraser. I'm the Director of the Office of Special Services and Inclusive Education, birth to 22. That includes CDS, and I'll pass it to Sandy.
Hi, good morning. I'm Sandy Flack. I am the Acting Deputy Director for the Office of Special Services and Inclusive Education, working with Erin and Megan on this very important work.
Great, thank you. Well, I'm going to try to jump to sharing my screen. Let's see how technology is working for us today. Are you able to see my screen? Terrific. All right. So what we'd like to talk to you about today is about the transition of the Child Find and FAPE, or Free Appropriate Public Education responsibilities, from CDS, Child Development Services, which is a quasi-governmental agency that stands separate from the Department of Education. They have maintained those obligations for Child Find and FAPE for birth to 5 years old, or up to when a child turns 6, for children with IEPs and IFSPs, and that stands for an individual family service plan for our infants to 3-year-olds, and an IEP is an individual education program for our children who are 3 all the way up to 22. This is a pretty significant shift in the course of the almost 40 years of its existence. There have been more than 40 different legislative efforts to make this transition, and this one seems to have taken. So I'm going to walk people through the elements of the law. And the first piece I want to just sort of talk through is we've learned has been a point of confusion for some folks in the field in the last few weeks. All session long, the language of this bill kind of lived in 2 lanes. It lived in LD 345, as well as the language of LD 345 was included in the language of the supplemental budget. And so LD 345 was worked in the Education and Cultural Affairs Committee through public hearing and through numerous work sessions. And it was amended and crafted as it does as it moves through the process. And that bill, however, did not make it off of the appropriations table. And so many people saw LD 345 did not pass and assumed that this initiative did in fact not go anywhere. But the language, including all of the amendments that were done through the legislative process, were included in their entirety in LD 2214, which was the supplemental budget. So that's a really important piece just to be clear on, is that is now obviously public law 2024, chapter 643, and the language from 345 is now part W of that law. I want to hit on a couple of elements of the law. I'm going to move through this part pretty quickly, in part because my colleagues Sandy and Aaron will go a little more deeply into sort of how those elements of the law are actually being implemented at this time. So the first thing to know about some of the language of the law and what the law calls for is it does call for a 4-year transition of those child find and FAPE obligations from CDS to SAUs, with the final implementation or adoption fully across all SAUs by July 1, 2028. A piece that is not actually written in the slide here is that throughout the language of the law, a focus on a least restrictive environment is included in the language of the law, and it is a priority for this work. And what that means is that under the Individuals with Disabilities in Education Act, or IDEA, it is essential that students have a right to receive their educational programming in the least restrictive environment. That means alongside neurotypical or typically developing peers, and that is a priority, and that is absolutely aligned with the work of our team at the Department of Education, but that is a priority of this law also. This law also does provide for flexibility in terms of how those services will be delivered. They do not require SAUs to stand up programming and cover all of the service needs of all of their children. Instead, it does imagine providing these services in a mixed delivery system, in a system where SAUs can partner with providers and with even regional or state partners, as well as with CDS. And that before an SAU can assume that FAPE obligation, they have to go through a readiness plan and have approval from the Commissioner of Education. This bill also requires funding, a fund to be set up that will fund this project fully. Historically, this has run into problems as different communities have wondered how they're going to meet the local state share. The special education services, when they've been offered in CDS, have been funded at 100% state cost without that state local share. And that continues with this fund. Another piece that was also included in this legislation is for the cost of high cost in district and high cost out of district placements. We do recognize that when SAUs are needing to provide services, some children have much more intensive needs, and that needs to be included in order to fully fund the cost of providing services and education for all of our students. And that is included in this language. Finally, there's additional funding that is included in the supplemental budget in section CCCC. I think I said enough C's there, and that is for a special revolving renovation fund to be set up to help SAUs with some of the transitions that they may need, including updating facilities or what is required in order to be an approved facility. The challenge with the revolving renovation funds is that by calling it revolving renovation funds, it does fall under that section of statute and rule, and it does take a process for applying for those funds and then getting local approval of those funds, the bonding process. And so in order for those funds to actually go out, we expect those will not be available for SAUs until they're in the cohort 2, so in another year or so. A really important element to know about this law is that it does not end CDS. In fact, CDS is an important and vital partner to continue this work, particularly for children in Part C. And when we talk about Part C, that is another section of IDEA, and that applies to, and I'm sure most people on this call know that, but I'm just going to clarify, for our infants and toddlers. And so these are our birth to 3-year-old children. And there are a lot of details in Part C, but again, sort of the high level view of the legislation does imagine sort of how CDS will still continue to provide services for children in Part C. And it does also require the Department of Education to look at what is the eligibility criteria for children to be eligible in Part C. So those are some pieces that are included in this legislation. And then over the course of the next 4 years, CDS, as it is set up now as a system, is a system with 9 regional sites. And those are set up geographically. And what those sites will do is they will transition from these regional sites into service and support hubs that will be shifted to align with the superintendent regions. And we believe that's going to provide greater efficiencies across SAUs as they are working to work with CDS as a service and support hub to get the services out to children. The law does also call for wanting to make sure that CDS maintains minimum services that is available at each one of those sites. And then also recognizing that as SAUs assume the FAPE and child find responsibilities, that they may have a child who comes into their SAU who has not had all of their services provided for in the time that they were at CDS. If that is the case, CDS and the state still maintains those due process and compensatory education costs. Finally, there were a couple of other exciting provisions included in the language. And one of those is that the Pathway Pilot Project is going to continue. This is a project that we've funded for the last year and is going to continue. And I'll talk a little bit more about that a little bit later in this presentation. And then there are some other pieces that the department is required to do, including establishing a centralized Maine care billing system for Part B. Again, Part B includes our 3-year-olds up to 22-year-olds. So it's one little bullet point, but it's a big bullet right there. So did want to just highlight that. I'm going to now turn it over to my colleague, Erin.
I was wondering if
I was like, I almost just kept going. I wasn't even going to stop.
I know you're really enjoying yourself. Anyway, so I'm going to talk a little bit about the coordination of the implementation of this, because as Megan mentioned, it's culturally instilled in us that these preschool services for special education are separate from our SAUs, our public education agencies. So in this work, we're tasked with doing a tremendous coordination of efforts across the teams in the Department of Education. And the teams include the Commissioner's Office, the data team, the fiscal team, my team, obviously the OSSI team, the CDS, including the CDS site leaders, early learning team, and school facilities. So basically, all of these teams have a critical role to play, and there's a lot of work that's happening right now to support the SAUs that have stood up and said, we'd like to do this earlier than the law and demands. So this coordination has required a lot of training around just simply organizing how we create and communicate different documents to each other. So it's been a tremendous coordinated effort across our teams. And Sandy will talk to you about the teams and where they're located. I mean, the cohorts. Maybe.
Sorry, my slides are doing something odd. I'm going to stop sharing and see if I can.
Oh, actually, Megan, this is the initial work slide, and this is back to you. And then Sandy's going to follow up.
All right. Sorry about that. I'm just going to change my presentation. I just realized I am actually presenting a different presentation, but it works. It's the similar one from what we were using before. So. Erin, do you have?
I do. You want me to share?
No, I don't think you have sharing right now.
Do you want me to email this to you?
I have just a second. I apologize for this.
I just gave Erin the ability to share. If she wants
Okay,
to
so
share.
Erin, if you can share, that'd be very helpful.
Sure. Get the bar. All right, there you go. And this is you, Megan.
Thank you. Again, apologies for that. So the initial work I wanted to just sort of highlight, one of the challenges obviously is the timing of when this bill passed relative to the preparation that is just part of what all school administrative units undertake. As this bill was moving through the legislative process, this was happening obviously in February and March and April. And we had significant conversations from the department with stakeholders that included superintendents in particular, SAU representatives, business managers, and other educational organizations, as well as folks from other agencies and private providers. And as we were having a lot of those conversations, and it became apparent that the bill was moving through the legislative process very positively. And once it was passed out of the Education and Cultural Affairs Committee with bipartisan support, we really realized the need to make sure that while the law was not yet enacted, that we had implementation teams working behind the scenes so that when it was enacted, we would be in a position to actually implement this law. But that required a little bit of a leap of faith from our school districts. For folks who have been a part of a school district budget building process, that really starts in November of the prior year and really gets cooking with school boards and such in February and March, right when this work was really kind of taking shape. And what we found is that while we were really doing a lot of this work with our SAUs, we do have to sort of be aware of that timeline and sort of how that affected the uptake of this work. So with that sort of caveat, I'm going to hand it back over to my colleagues Sandy and Erin to take us through the next two slides.
Yeah, so as Megan shared earlier, part of the law required school districts to go through a self-assessment or looking at their readiness. So we had many SAUs reach out saying that they were interested. They had either already been collaborating with CDS to provide services or felt like their district was in a good place to start this process. So one of the first things we did was provide them with a self-assessment that they would walk through with their team and us if needed to help answer those questions to see if their SAU was ready to take on this important work. One of the other things that we asked them to do is identify a preschool team lead so that we would have a consistent contact person. For some districts, that may have been the special education director. It could have been the superintendent or a principal of an elementary school. We really looked at whether the SAUs had existing preschool programs and or if they needed professional development or expansion for programs to support preschoolers. We looked at the professional development opportunities that each district needed in regards to best practices for administrators, leadership, staff, and educators that where preschoolers may be new to their building. We also looked at with each SAU to see how they were providing special education and related services in the least restrictive environment and how they were going to provide that for their preschool population. And then we also looked at the current caseloads that CDS had, the numbers, and we know that those are always fluctuating. We also looked at the types of disabilities and services that were required on the IEPs. We supported them in conversations about staffing and what that might look like. We worked closely with our fiscal team on providing SAUs with a funding template, and also looking at what current community supports are available. If there are private preschools, if there are childcare settings, if there are private related service providers in their area that could help support this process. And then we also in CDS have someone that has been, her role is to support preschool programming and development in looking at it through the lens of students with disabilities and ensuring that materials and spaces are appropriate. So the one thing that most school districts were maybe a little hesitant about was taking on 3-year-olds. So we had many conversations with districts about what does that look like for a 3-year-old to be in a preschool program? How could you provide FAPE? What is that requirement on an IEP for FAPE for a 3-year-old student? And really looking at how SAUs could support them through looking at multi-age classroom models. Go to the next slide. So here we are, we have cohort 1. We have 18 SAUs that we have identified, and they have identified their interest. And so we provided this list. It's broken out by the CDS regional site. And then in parentheses is the town that that CDS site is located in. So as you can see in opportunities, there's 1 SAU, Midcoast has 5, Reach, which is the Portland area, has 1, York has 3, Down East has 2, Two Rivers, which is the Brewer area, has 5, and Aroostook has 1.
I'll just add that, again, as Megan mentioned, the budget process for a lot of these SAUs was happening as this work was unrolling. So we already have a pretty strong list of cohort 2 folks that started out initially expressing interest, but felt that they couldn't secure that feeling prior to this fall. So we already have this list started though for cohort 2, and we're excited to continue this work in the fall with the next cohort.
Can I just add to the previous slide, Erin? I forgot to mention that there are approximately 160 eligible children in this cohort 1. And we wanted to just let you know that we continue to collaborate with, CDS continues to collaborate with SAUs. We have 67 SAUs that collaborate with CDS to provide services to children. And that is right around an additional 630 children that are being served through those collaborations.
And we continue to obviously provide a lot of support for CDS as we're doing this work. We started focusing on the SAU collaborations, and they've been going really, really well in terms of the SAUs developing relationships and understanding and learning these children prior to them coming to kindergarten. We're still obtaining data on the kinds of benefits that the SAUs who are working with these children. Not as many of them are working with 3 and 4-year-olds, but we do have a couple that are in there that are working with 3 and 4-year-olds, and the benefits are just, staggering for them entering, being able to transition these children successfully into kindergarten in a less restrictive environment in Maine. You have probably heard me say that our children in preschool are an inordinate amount of them are in more restrictive environments. So that's something that we're as a state looking at, and why inclusion is so important to us. So we're going to continue to provide services to the regions in the work that we're doing currently. Obviously, we continue to function. We're also working with SAUs in cohort 1. And so each SAU in cohort 1 will begin to develop a list of activities that the CDS service sites, service and support hubs will be providing for them. Because our state has done child find through CDS for almost 40 years, it is likely that that pattern will continue as we're in this transition. As Megan mentioned, I think there are still schools and professionals and providers out there who don't understand that this has actually become law because of the fact that the LD 345 was dropped and it was moved into the budget. So we're continuing to provide professional development and employee supports for this transition, and kind of shifting our focus to understand how to support the SAUs in the provision of these services, which is a significant change in how CDS has conducted itself previously. We are continuing the Pathways Project. The Pathways Project to date has certified up to 40 CDS employees to obtain their 282B in support of special education for this age group. And then we are in CDS, have been for some time trying to update, and those things are on the horizon now, update their fiscal and data systems to support a better understanding of the data as we see it in CDS. So CDS is still vibrant, up and functioning, shifting our role for these 160 students in these 18 SAUs that are going to be early adopters, cohort 1, and and then continuing to support our SAUs who are providing services to children in their catchment area.
I'm mindful of time, and I know we're a little bit over, so I'm going to just move through this slide pretty quickly. We do recognize that while we have needed to, just because of the timeline, focused a lot of our energies on internal systems to ensure that this change can happen, from everything from data to the fiscal side, making sure that we've got a plan for getting the funds out to those schools that do identify as being cohort 1. Now we recognize the need to sort of shift our attention, and to not shift it like away from, but include all of our cross-agency partnerships and our partnership work with our providers throughout the state. We've been having regular meetings with members of the Preschool Development Grant, and they've helped to identify licensed providers. Cross-agency teams are meeting to talk about how do we support these services being delivered in a mixed delivery system. And then obviously we will need to continue our collaboration with OMS to ensure that we are able to stand up that billing. But a lot of great collaboration already happening at this point. So with that, we'll open it up for questions. I know we went a little bit over. So
you're fine, Megan. I put in a 5-minute cushion at the end, so you're fine. So we have time for
you knew we might run over. Okay.
Yeah, this happens. Any questions for Megan and Aaron, Sandy?
We must have done a thorough job explaining.
You did a very thorough job, very extensive, and thank you guys for all of that information. I'm sure folks will continue to have questions as implementation moves forward, but we do appreciate the partnership and the cross-agency work that is happening now. So we think about how to support SAUs to also partner and think about ways to partner with our early childhood education mixed delivery system. So thanks, you guys. And again, if anyone has any questions, feel free to either reach out to folks directly at DOE, or you can funnel them through me. And we will be continuing to talk about this topic at Children's Cabinet staff meetings as well. Great. So I'm going to shift us now to a conversation around some of the efforts that are happening, particularly at Office of Child Family Services, but really a partnership between Office of Child Family Services and Maine CDC, and talk a little bit about, I'll just kick us off to talk a little bit about a couple of the initiatives that are being funded through the Preschool Development Grant, really to support new Mainer families with young children. And this really we've identified a handful of initiatives within the Preschool Development Grant, and they are underway, which is exciting. And I just wanted to cover a couple of them. We're going to focus specifically today on the work happening through Help Me Grow and with the culture broker at Help Me Grow. And I apologize, this is coming up a little funny. I was hoping it would not come up this way. But here's my slides coming up in a little funny manner. But just wanted to provide an overview of some of the pieces that are being funded through the Preschool Development Grant. We have provided 4 grants to 4 community-based organizations, and they will be funding community health workers at those organizations who are part of the New Manor community to be connecting with New Manor families with young children, to really make those connections and supports to help families access early intervention services, healthcare services, such as really ensuring that families understand what happens at well child visits, kind of being a partner as they work with their healthcare providers, as well as helping families connect to other basic needs. The grantees are throughout the state. We targeted three communities that we wanted to ensure that we would have grantees. So there are 2 grantees, ethnic community-based organizations in Lewiston, that are doing this work and working directly with parents. One is doing more of a home visiting model, while the other is doing more parent group support meetings. And then in Portland, we are working with Greater Portland Health that will have community health workers embedded at Portland Health to be able to support pediatricians and their providers who are working directly with New Manor families with young children. And when I say young children, we mean birth through age 8. And the goal, and then in York, we're working with York County Community Action Agency. And the goal is really to provide those tools for New Manor parents to support their young children to grow and thrive. We've also established a new parent leadership training program for New Manor parents. And that's really collaboration between the Educare's Parent Ambassador Program and Portland Empowered that have been working with parents and developing parent leadership around understanding child development, understanding programming for young children and families, and providing that tools of advocacy. And these leaders will be going out and leading community conversations within their communities with parents to expand and extend their leadership. I'm going to turn this over to Jacques, who has been at Help Me Grow since last fall. He is Help Me Grow's cultural broker and family resource specialist. He has been doing phenomenal work, really developing and building the work at Help Me Grow to make greater connections with New Manor families with children and helping them to navigate systems. And he's been through this work, really identifying ways in which Help Me Grow can expand their work in supporting New Manor families with children. So I'm going to turn it over to Jacques, who's going to talk a little bit about the work that he's been leading at Help Me Grow.
Thank you, Anna. You can go to the last slide. Cultural brokering task.
Okay, great. You want me to go to the last one?
Yes, thank you. Okay, my name is Jacques Galimo. I'm a family support specialist and cultural broker with Help Me Grow. I was in New Manors. Now I can say I'm not anymore because I know the system. I can navigate the system myself. I'm almost in America now. But at least I was a community leader. I work a lot with New Manors. And Help Me Grow, we connect families with resources. And also we identify gaps and barriers. And as a cultural broker, I identify some gaps that was like a major gaps about misinformation and misconception of New Manors. Maybe it could be due to lack of genuine channel of communication or level of study, even language as well. And I found out that these gaps, lack of information and misconception has serious consequences. Okay, some New Manors lost babies, and we had some stillborn and removal, and a lot of consequences. And even some New Manors will be incarcerated because of lack of information. So yes, I've got a slide. Thank you for the slide, Anna. The last one. Thank you. And I found there was a need of building a bridge between providers, even the states, with new manners, and even facilitating communication to try to reduce trust and conflict, and even to advocate, like a two-way communication. I found out there was not a structure that you can get information from the bottom and even information from the top down. And also I found out we didn't identify a correct way of communicating effectively with new manners. And that's why I come with a task force. I call it Cultural Brokering Task Force. Okay, where I bring together community leaders, elected community leaders, spiritual leaders, interpreters, school and medical interpreters, cultural brokers, and teachers, and even those I call trusted leaders. Those are the people that they have impact on the community. They trust them. They know how to communicate with the ethnic group, because sometimes we believe and we think that all new manners come from one ethnic group. That's not the case. That's why sometimes we miss our target because we don't understand the dynamic, even a geopolitical, even the history of different groups of new manners. They are totally different, and we've got new manners in different season of periods. And sometimes we treat them the same way, and we miss totally our target. Now, most of the new manners we have, they are Lingala, French, and Portuguese speakers. These are the people that sometimes we don't reach them because we use the old way of dealing with new manners. We need to understand the dynamic of the ethnic group so that we can be able to help the caregivers. And by the caregivers, we can work for the well-being of the kids. Because when most of the new manners are totally misinformed, they have misconception, they get information from everywhere, and that impacts the kids because they are denial. They try to skip developmental services, and there are a lot of consequences on the kids. So I came with this what I call cultural brokering task. This task, how aim is, we're gonna use this task. We've got 20 members from different groups. As I said, they speak Lingala, Portuguese, French, Swahili, Kinyarwanda, Arabic, Pacho, Dari, and Spanish, and Spanish as well. This group, we want to utilize them as a group for cultural responsiveness, because we found out that we have some screening tools that doesn't meet the culture of the people that we have. And sometimes they don't have a voice where they can, a platform where they can be heard, and so that we can advocate even to bring change. And this cultural brokering task force, we're going to use them as well for proofreading. Sometimes we've got brochures, forms in different languages. Myself, I speak different languages. I've got some forms is in Lingala, but I don't understand the Lingala. But we invest money, we put money to, but no one proofread them. And that is a big problem that we found out. It was a gap as well. And also we want to try our best to facilitate communication, because the new manners that we have, most of this current influx, those that speak Lingala, French, and Portuguese, they communicate in the word of mouth. They don't, I don't say that they can read, they don't really communicate a lot in reading, but mostly is word of mouth. So we've got all the leaders, we know how they communicate to the population. Mostly is through visual, okay? They use a lot of TikToks and Facebook. They don't follow our news, radio, even if there's any recalls, they're not aware of that, but they communicate through Cash App, WhatsApp group texting platform, and they've got their own website or YouTube that they use. And those leaders can be used to spread important information, even new programs. And also what is important for this group is to address miscommunication, as I said, because these leaders, they trust them. I've been many cases where there was a denial for developmental services. When I step in, because I speak the language, I'm from the ethnic group, they trust me and they cooperate with the system. So to try to reduce mistrust and also miscommunication. And also, I believe that this group, we should be able to get in crucial information, to use different platform of communication to the new mainers, and even to get information from new mainers to providers as well, because we can also educate providers. That's why we've got a pilot project for 3 months. We start already, we had the first meetings, and the first meetings, we try to identify different misconceptions and how new mainers got information. And the next meetings, we're gonna have subject matter experts. Those are the people that are gonna help us with crucial information. We want to focus on prenatal and birth. Most of new mainers, they're skipping a prenatal case because of misinformation. They believe that they're giving them some injection that's causing children to have autism. But we need to educate them, but we need to use this platform to educate them. So we want to have simple information, crucial information. We're gonna get from providers. We're gonna put like short videos for 5 or 10 minutes, 5 minutes or 4 minutes. And then we're going to use these leaders, because we know these leaders, we know how they can reach new mainers, how they can spread this information. And that should be a pilot project. By July, we believe that you're going to have these short videos about prenatal and birth. And then also we're going to be a two-way communication, and also how we can educate even providers. That's what we're doing. And I know that the time is running against us. I can talk for many hours, but I can stop here. Thank you so much. I'm not sure if you've got any question.
Thanks, Jacques. A lot of great work happening. Any questions for Jacques? We have a couple minutes. Yeah, Erin.
Jacques, I am not on the PDG work, and I know that my colleague Jackie Herson is, and we've had a couple of staffing changes in CDS, but I noticed CDS is on your list of things to communicate. And in CDS and across the state, I'm working to understand how we can support understanding special education and early intervention, as it's culturally very unique, and it's very different from how other cultures approach education. So I just want to know if there's someone on CDS right now who's in your task force who's supporting the work of understanding the difference between early intervention and special education.
Yes, of course. And I'm doing my master's and my internship with CDS, and we work closely with CDS. It helped me grow. Ariana is part of the cultural group that we're working on.
Excellent. That's what I wanted to hear. Thank you, Jacques.
Thank you.
Great. Perfect. Thanks, Jacques. I am going to wrap us up. Commissioner Lambrou snuck out before we could all say how wonderful and amazing and how brilliant she has been as our leader of the Children's Cabinet, as chair of the Children's Cabinet. And so I'm just going to end with saying that. I don't know if any of the other commissioners want to say a quick few words. We can share it with Commissioner Lambrou later, and I apologize for not being able to do that while she was on the call. But Commissioner Fortman or Sashchik, anything you would want to say, just an ending?
Yeah, thanks, Anna. Jean's an operator, right? That's nicely played right there. She absolutely hates that piece, but we were going to get her anyway. We'll see her on a cabinet call later this afternoon, and obviously we were together yesterday at the Blaine House, which was a nice event in honor of her. She's a brilliant, incredible leader. It's amazing to have that technical skill set combined with compassion and all the things that make her and this team so special. So I guess I would just close with that. And I promise to ambush her repeatedly until she leaves on behalf of the group. So thank you.
Thank you.
Definitely nothing to add to that. I think Commissioner Sawstruck did a great job summarizing everything.
Okay, great. Well, I'm going to wrap us up. It is 11:30. Thank you, everyone. This was a lot of information, and just thanks everyone for all the presentations about all the good work that's happening. We will see everyone in July. July 16th is our next meeting. We will definitely have an update on the Child Safety and Family Wellbeing Plan. And if there's other issues that folks want to cover, please let me know. Great. Thanks, everyone.